Don't let it be a case where you're an international nurse or you're a nurse in general and you move from your country and then you come to another country, come mad out. Don't let it be a case like that. Don't let it be a case where the stress of being an international nurse, puts you in a position to become mentally disabled or mentally challenged. And because some of the international nurses are on contracts, it's difficult for them to break those contracts. You can't really walk up and say that you're feeling stressed out or you're feeling like you're anxious because of the environment and they cut a contract like that. It's not like that. I'm gonna be using my TikTok lip gloss or a lipstick. So hi everyone, welcome to the channel. So today we're going to talk a little bit about nursing burnout, and we're going to focus a little bit more on international nurses and why they experience it so often, or why it's common among that population. And burnout is very common to all. It's not only to nurses, but definitely I want to just kind of dive in a little bit to see how we can actually prevent this. If you haven't subscribed as yet though, I would love for you to go ahead and subscribe to the channel, like, share, comment, turn your notification bell on for more content related to nursing, travel, and lifestyle. And there are a lot of content on my channel here. Please feel free to go ahead and look them up, find information regarding immigration and all. So let's just talk about burnout, because burnout is more of a state where you're feeling emotionally depleted, you're having mental exhaustion, and you are just physically drained, you're physically tired, and all of these are caused by prolonged stress. For nurses, that often happens because we feel as though we are overworked, we're undervalued, and we're also not supported a lot of times. And so as international nurses, we are more prone or at higher risk to these different, challenges that is common to like everybody. When I just moved to the States here from Jamaica, it was very, very difficult for me. Despite me having family here, it wasn't feeling, the whole transition was just difficult. Let's just say that. Moving from one culture to another means you're going to be learning different things. And as nurses, you will have to learn about the different healthcare system. You have to learn about the social dynamics. You have to learn about things like language, accent, because those are different. So cultural adjustment is one of the biggest problem, and it can be very overwhelming. It can be very exhausting at times, and this can just add additional stress to you being in a new country. And I think that is one reason why, a lot of us tend to feel burnout, especially in the first part when you're transitioning and having everything dealing with, including not having your family with you. Those are things that contribute to a significant amount of international nurses or nurses having the feeling like they're burnt out. Even though the language might be the same, there is always some form of misunderstanding or miscommunication when it comes on to your colleagues, your patients, and their families. When I was in Maine, and I will always talk about Maine because that's where I transitioned to, it was difficult for me at first because a lot of times I'm speaking and persons are asking, what language am I speaking? And I'm like, this is English. Like, I don't know what they're hearing, but a lot of times people will be lost in my speech or the conversation because they're trying to figure out where I'm from. And I'm like, well, yeah, I'm from Jamaica. The language down there is English, so accent is something that is gonna be a problem when you're transitioning as well. Another major factor that contributes to us being, feeling burnt out is the fact that we work long hours. A lot of us work long hours. We work 16 hours, we work 12-hour shift, we work 8-hour shift. And because of the high patient ratio as well in the US, sometimes it feels as though you are overwhelmed. So even though you might have 4 patients, just think of it that those patients are very, very demanding in terms of the workload. You have the long shifts, you have the weekends, the holidays, night shifts. All of those things are factors that you have to take into consideration that are contributing to persons feeling burnt out at the end of the day. And this is not only for international nurses. These are things that are common to like a lot of persons in different work environments. So you don't have to be a nurse to be experiencing those. But usually once you have transitioned from one country to another, you tend to experience 1 or 2 of these along with the stress from your job. And as I say, not having family support is difficult, and so because of that as well, it makes it a little bit difficult or harder for you to handle like certain stress at work that you normally would have that kind of tight connection or support with your family to give you insight or advice on certain things. Another thing that a lot of us, when it comes on to international nurses, is that hospitals or healthcare facilities sometimes have like high patient turnover ratio. And so when international nurses do get here, they find themselves in a situation where they're more responsible for a larger number of patients that they're usually probably not comfortable with. And so because of that kind of feeling, you might find that some persons may feel as though they are, that they're not competent or they're inadequate when it comes on to their duty. And some persons may have mental exhaustion from all of the stresses that comes with it. Because just imagine moving from a third world country coming to a first world country where technology, there's so many advancement that is going on that you're not accustomed to. Trying to understand that in a certain time period, how to take care of your patient using all of those advancements can be very difficult. They're not competent at their job despite them being a nurse for a certain amount of years, just because of the new advancement and the technology that they're now exposed to. When it comes on to networking, it's very important for us as international nurses. A lot of persons might find out that they don't have a mentor that they can always go and ask certain questions. So because of that, it might feel a little bit difficult when they're trying to integrate or get support in their environment. They tend to find themselves being isolated. They're not so sure how to go about with navigating or figuring out certain challenges or work situations that they encounter. And sometimes this leads to them being emotionally burnt out. Because of the stigma that is associated with mental health, you find out that a lot of persons who are suffering emotionally might not say anything because they want to keep their job and they don't want to be stereotyped. All right. Another thing that a lot of us are experiencing is the social isolation when it comes on to international nurses, because a lot of us are working so far away from home, so far away from families, their friends. The environment is not familiar. They're missing their loved ones, and so it is a struggle for them. It is a struggle for them to also build new social connections where, they can be emotionally connected with the person. And that can be emotionally taxing on that person. Because just imagine, you're in an environment thousands of miles away and you need somebody to go out and hang out with. You might not find that person because you're trying to understand the culture, you're understanding persons, personality and all of those things. It also adds stress, and then because of that, your profession, which is already demanding, is going to make you feel so exhausted and overwhelmed and eventually lead to burnout. All right. The other thing that a lot of us tend to experience is, or persons don't want to experience, is the stereotype and the discrimination. Sadly, some international nurses, they face workplace discrimination, and it is something that is not being talked about a lot. The environment at times can be very toxic to work in, and a lot of times you might find persons feeling as though they are not valued. They're undervalued, they're not treated the same when you compare to other persons, especially like their American colleagues. They're not treated the same. And so this unfair treatment that they are experiencing, it is not only contributing to burnout, but it also affects them mentally. It affects them mentally, and a lot of them do not seek medical help even though it is available at their fingertip. So you might find out that you have some persons who are struggling mentally, emotionally, because of the environment that they're working in. And because some of the international nurses are on contracts, it's difficult for them to break those contracts. You can't really walk up and say that you're feeling stressed out or you're feeling like you're anxious because of the environment and they cut a contract like that. It's not like that. You have a lot of persons who are dealing with those stereotypes, the discrimination, and it adds some form of emotional strain on the person. And then with the work being so demanding, the job of a nurse being so demanding, all of this makes it so difficult for that individual. And all of this contributes to burnout in the long run. All right. So we have to be careful when it comes on to our nurses, especially our international nurses, when they're transitioning from different places to come to one country and work. Because even though, yes, it is a choice for us, We have to remember that emotionally, mentally, persons are dealing with different things and reacting to different things. And we need to just be mindful that, it can lead to different negative effects. Let's just say that. All right. So in light of everything that I've just said, there are certain things that we can actually do to help with preventing burnout and manage it as an international nurse. And those are the things I would love for persons to start focusing on. If we don't focus on ways to prevent burnout in the future, then we're going to find ourselves either not having a love for nursing anymore. We're going to be just bitter all the time. We're not going to have that compassionate care that we normally have, or we're not going to have the empathy, because every day you go to work and you're feeling as though you don't belong there. So one thing I want persons to do is make sure that we're prioritizing self-care. Take some time away from everything else in the world and focus on you. Engage in activities that you can relax, you can exercise, you can meditate, spend time with your friends and your family members, so that way you can always feel a little bit more happy. Another thing is that you try to find persons who can be a mentor for you. Find somebody that you can talk to. You can find persons that you can work along with and make suggestions when it comes down to certain things. So it doesn't have to be a nurse from back home. Find a nurse here in the state while you're transitioning. Somebody that you can rely on, your supervisor, your boss. Find somebody that can be a support system for you. See how they can go about with helping you during those challenging times to make it a little bit more effective for you during your whole transitioning program. The other thing is that we need to stay connected with our loved ones and our friends. I know a lot of times we move from different countries and we come here and we feel like we reach there. No, don't forget about your friends and your family back home. Try to send out a text message every now and again. Reach out to other persons, reach out to your friends and your family and stay connected with them, so that way you don't have to feel as though you're homesick or you're isolated. Because when you do that kind of thing, what it does is that it puts you in a situation where, you feel as though you don't have any form of community around you. So there is Facebook, there is TikTok, there is Instagram, there's so many different social platforms that you can always go ahead and try to reach out every now and again to one or two of your friends who you used to from back then. And I personally need to be doing that a little bit more often, because I know that is not something that I'm not really a social media person, despite the fact that I am here on YouTube. I'm not really a social media person like that. But that is something that I'm trying to get back into, all right? And the other thing is that, you see, whenever we're faced with certain challenges at work or situation, we need to find the right persons to talk with. I know that burnout is something that is very overwhelming, and a lot of times we don't really want to talk about it because of the fact that we might think it is a mental health problem. It is very important for us to go ahead and talk with a mental health professional. A lot of hospitals, they do have employee assistance program available for our staff, and they do like counseling and support. Go and talk with them. Don't let it be a case where it reaches a point where you're getting so crazy with everything that is going on personally, back in your country and at work, where you get onto the psych facility. You don't want that to be happening. Whatever we can do from early, let's go ahead and seek out those help or the assistance and try to get the help we need from early. All right. Don't let it be a case where you're an international nurse or you're a nurse in general and you move from your country and then you come to another country, come mad out. Don't let it be a case like that. Don't let it be a case where the stress of being an international nurse, puts you in a position to become mentally disabled or mentally challenged. All right, as I say, it is important for us to go ahead and put plans in place, be proactive, and just make sure that we are looking at our health, our mental health. Self-care is very important, and in everything that you do, don't forget that there are other persons out there. Don't feel as though you're alone, because you are not alone. So go ahead and seek out help, build relationship, form support groups, do some form of networking and see how you can thrive in your nursing career while you're in the States or whichever country you're in as an international nurse. Thank you so much for tuning in and for watching the Think Nursing channel. And if you're an international nurse and you're going through any form of burnout, I'd love to hear your thoughts on the topic, your experiences, and what is it that you think is contributing to you feeling that way. So go ahead and leave your comments in the box below, and remember to like, share, subscribe, and turn your notification bell on. And we'll just try to shed a little bit more light on, you know, burnout, so that way persons can know how to go about with finding different resources and prevent it as much as we possibly can from early. Until then, I do hope you will take care of yourself, and I will see you in the next video. All right, bye.